Hi, my name is Jill Feldman. I'm a lung cancer patient and advocate. Thank you for joining us on Hope with Answers today. I'm here with Dr. Lael, and we are going to talk about EGFR lung cancer.
Thanks so much, Jill. Please call me Natasha.
Okay, thank you, Natasha. To start with, what does EGFR mean?
So EGFR stands for Epidermal Growth Factor Receptor. It's most commonly a protein expressed on your cells in the skin, but can also be found in a lot of other tissues throughout the body. EGFR is important in many cancers, and what's fascinating is that about 15 years ago now, we discovered that there are very special mutations in some people's lung cancer, and that it actually has changed the way that we approach treatment.
Okay, so I tested positive for EGFR lung cancer. What does that mean for me?
So nobody wants to have lung cancer, but the truth is that if you're going to have lung cancer, EGFR-positive lung cancer patients have the most hope, I think, of all patients with lung cancer. And so, it's such an exciting time. It means that people with EGFR-positive lung cancer have a real chance to have targeted therapies, to avoid chemotherapy, and to live longer and to live better lives.
Okay, how common is EGFR lung cancer?
So it varies depending on where you are. We more commonly see it in people who've never smoked. It's more common in Asia, so we see it in about 60% of people with lung cancer in Asia, anywhere from 15 to 30% of people in North America, really depending on where you live. So in places where lung cancer is mostly in never smokers, so California or Toronto or Vancouver, we really see that, whereas in other places where maybe we see a little bit more smoking-related lung cancer, the chance of seeing it is a little bit lower, so 15 to 20 or 30%.
Okay, and can you explain again what that means for treatment?
So when we find certain types of EGFR mutation, it means that people can actually have a tablet or a targeted therapy instead of chemotherapy as their first line of treatment. Increasingly, we're developing newer drugs. We're finding that if the first targeted therapy stops working, we can move to a different one. So you can go from a tablet to a tablet, targeted therapy to targeted therapy. You can push off chemotherapy longer and longer every year.
And that's hope.
That absolutely is.
Thank you so much for joining us today on Hope with Answers.